with not just the South Asian community. I know CASSA is an organization that works primarily with the South Asian community, but we've learned early on that the work of equity is done and is more impactful when we do it together.
It's such an honor working alongside CASSA. It's been a great opportunity to continue to champion the issues of equity and advancing justice and making real impact in community.
Today, it is my hope that we can continue strategizing for change in our system so we can build the blocks of greater health equity in our community.
The COVID-19 pandemic has worsened and exacerbated healthcare inequities, leaving racialized communities to face significant challenges.
Some of the recommendations that came out of the expert consultations, one of them is update medical school curricula to incorporate the education of unique conditions faced by basic communities.
The pandemic increased isolation and stress, especially in senior care homes, and brought a surge in anti-Asian discrimination.
So what happened with you? They didn't know how the system worked, and then when they have any health problem, they Google. They don't go to a doctor. So this shows that there's a distrust in the healthcare system.
One example was a newcomer, for example, not taking their medication that was prescribed by their doctor because the doctor didn't know to specifically let them know that it's halal. So the newcomer ended up not taking their medication, and that was just later discovered by their caseworker.
When you get to the question of closing equity gaps, you need to get closer and closer to the neighborhoods. So that leadership has been really instrumental in finding the partners both on the health and social side, redefining what requirements exist by population, really understanding where the gaps are, and really understanding what's driving those gaps in equity and access.
Last week in Toronto, we focused on the South Asian communities, we focused on the Arab communities, as well as the Hispanic communities. Today, we focus on Indigenous, Black, and East Asian communities. The goal of the summit is to find commonalities, intersectionalities, where we can initiate discussions with decision makers on systemic changes.
Today, we will rally, as Sonia said, and work tirelessly to continue uplifting the neighborhoods we call home.
We wanted to engage with CASSA is to really understand what kind of policy levers can come out of these discussions.
My name is Dr. Roberta Timothy. I am a professor at Dalalana School of Public Health. And today's conversation, we talked about the importance of decolonizing health equity and looking for a solidarity place and space amongst intentionally racialized folks.
Yeah, we want to be at the table, but representation without influence is tokenism. What is needed is a complete overhaul of the systems in which healthcare is delivered.
Effective medical practice involves understanding the context in which individuals and families live, and working to change those as well as healing the body.
We really need to focus on cultural humility as well, which is, the idea that we don't know everything, that we're in this ongoing process of self-exploration, self-critique, learning, combined with the willingness to learn from others.